So welcome, ladies and gentlemen. My name is Arnis. I'm the Principal of Liddim's Dental, and today's seminar is on the AO4 Dental Implant technique. Who's this appropriate for? Well, just to make sure you're in the right place today. This is a technique that's been helping many people. It's for people that maybe currently wear dentures and really don't want to have dentures, they're sick of them. It could be for people that are coming to the end of the line, that their teeth are possibly beyond hope, or it may be for people that have already looked into having dental implants in the past and have been told that the only way that they can have dental implants is if they have major bone grafting surgery. So let's have a look at what we're going to cover today. So during today's seminar, we'll cover dental implants in general. We're mainly going to talk about full jaw dental implants rather than single dental implants. The AO4 procedure, we'll talk about the different steps of the procedure. We'll show numerous examples of people that have had the treatment done. It's not appropriate for everyone, so we'll go through the selection process and we'll go through costs. I mean, it's not an inexpensive procedure for people. We understand that. Most people that come to see us need to think long and hard if the procedure is appropriate for them. And we'll go through maybe some of the ways that we can make it more affordable for people. So who are we? Well, our background is that we were originally in North Terrace for 21 years. The practice was known as Adelaide Prosthodontics. I mean, no one could pronounce that. Even dentists struggled to spell it right. So we were involved with teaching. We gave lectures to dentists and other people around Australia and overseas. Up until now, most patients that came to see us were referred. By law, that's how it was, that people needed to see someone before they came to see us. The law was changed a few years ago, and now people are able to come directly to us without the need for referral. In addition, we found that doing all these lectures that we had many dentists and doctors and other specialists coming direct to us to have their own treatment done in their mouths. So things got busy. We then found that the facility we had really wasn't coping with what we needed, and we'd really outgrown our existing site. And I had a vision that we could actually produce a facility where under one roof we could have all aspects of the treatment, including the assessment, done in a seamless approach. So how did we do this? Well, we needed to be able to have a facility that had advanced services, the state-of-the-art facility with an experienced team. And the team needed to not only have good skills, but needed to have a passion for helping people with the types of problems that we see. And we needed to combine not just specialist services, but general services, so we could help everyone depending on their level, whether it was from a single tooth problem to a full mouth problem. The key features were that we needed to have a surgical suite where people could come in and in one day they could be asleep while they had their treatments done. So we needed an on-site resident specialist anaesthetist. We needed to bring together an experienced team of people, and I've been very fortunate that the key people in my team have been with me for nearly 20 years, and we've grown from that to a team of over 25 people now. And we needed to have an in-house dental laboratory. Now, I call this our little tooth factory, that we actually can make all our teeth on site, whether it's ceramic or acrylic or dental implant treatment. But the really nice thing is that the people making the teeth get to meet the individual. Now, what's happening in the world of dentistry is that a lot of technical services get done elsewhere. They don't get done on site. So unfortunately, the person doing the technical support work doesn't meet the individual. And they'll just get a plaster cast of someone's teeth or implants, and they'll look at it and they'll say, gee, I wonder, is this person aged 19 or 90? Are they male or female? What sort of personality do they have? Are they sort of a bit shy and reserved, or are they life of the party? And you're going to set up teeth very differently depending on people's individual circumstances. And the risk is, if the technicians don't meet the individual people, the patients, they will have no idea. And the problem is that people can end up with just piano keys for teeth, which the appearance of them might not be very natural. You know, most people that we see say, look, I don't want my teeth to be that obvious. I just want my teeth to be natural, vital, healthy, appropriate for my age group. Computer imaging is an important part of what we do. In the past, people didn't know whether they were going to be able to have dental implant treatment done until the surgery was done. Often people, you know, and we heard of cases where people went in for surgery, things were started, someone said, I'm sorry, you don't have enough bone, stitch you up, see you later. That can be pretty soul destroying. So in our facility, we have the ability to take three-dimensional x-rays, work out where the volume of bone is. In advance, we can do virtual reality implant placements. So we actually do surgery on the computer, and we can look together. We can actually look at the model of people's jaws so they can understand where their bone is and where it isn't, and where we can place implants at an angle so we're able to give them teeth in the day. We also use this as a training facility. We have dentists regularly coming here. I mean, we even have teams of other specialists that visit from interstate at times, wanting to learn more about the advanced techniques that we offer here. So who am I? So my background is that I've been in practice for nearly 30 years now. My first 3 years I was overseas, and I did my specialist training and became a dental board registered prosthodontist. So what is a prosthodontist? Well, I guess people come to see a prosthodontist often when they come to the end of the line. They might have fairly complex problems. They might have a dental disaster in their mouth, and they're looking for advice to see, is it possible to save their teeth? And at times it is possible to save teeth. Other times, things are beyond hope, and unfortunately, people end up losing their teeth, and we need to look at other options. And those options may be dentures, may be implants. Let's have a look. So, types of treatment. I mean, people come to us with various concerns. Some people want advice where they know that they have serious problems in their mouth. I mean, some people say, oh, I've got a dental train wreck in my mouth. Some want advice primarily to do with function, to improve their eating. Some want improvements in health. You know, there's a bigger understanding these days about the interrelationship between oral health and general health. Some people are primarily concerned with the smile. Some already know they want dental implants. But the big thing is that people will come to us at times because they have had patchwork dentistry done, where they've had, oh, you know, this tooth's broken here, can you just patch that one up? Oh, this one, I don't like the look of this black filling, can you do a white one there? And oh, this one hurts, can you do we need a root canal, and oh, maybe I need a crown on this tooth. And their mouth can end up looking a bit like a patchwork quilt. What people are after at times is to get the overall effect, one that's not something where people are drawn to the teeth because something's wrong. They just want it to be a nice, pleasing, warm smile that complements the rest of their features. So we do a big picture approach where we can give people an assessment of their smile, not just at the level of individual teeth, but we can actually talk in a sense of how their smile looks at a social distance. How are people going to interact with them? And that seems to be what's more important for most people. So when people come to us, I say to people, there's not just one option of how we can help people with their dental problems. For most people, there are numerous options. And the key to it is that we're able to provide innovative options for people, covering the advantages, the disadvantages, the risks and the costs of the different options, and then it's up to people to decide what they want done for themselves. I mean, two people with the same mouth are going to have very different treatments. So let's look at the considerations. So the first situation, what if people have still got their teeth, but they're severely broken down? Well, the first option is do nothing. Just accept things as they are, and basically just fix emergencies. If something hurts, pull it, something breaks, fix it, so forth. The next option might be to try to restore teeth. So if there's still enough tooth structure left, then we can save teeth. We can actually protect them, cover them, we can make them look better. The final option is where we remove and replace teeth. So that's when things are beyond hope. So in some places in the world, the options are pretty limited. You get what you get. I mean, dentistry can be done at the local market. I mean, some of these places we're told perhaps you shouldn't, you know, the Australian government says perhaps you should be careful about drinking the local water because it's dangerous. Well, why would you have major surgery done in countries like that? People come to us and they say, look, some people come to us wanting cosmetic dentistry, some want dental implants, but some say, I want a dental transformation. Now what's the dental transformation all about? Well, the cosmetic dentistry is about, I hate my smile, dental implants is about, I don't want dentures, but the dental transformation is about, I want everything fixed. Let me show you a case that highlights the type of transformations that people can have done. This is Nicole, who came to us after having been kicked in the face by her beloved horse. And she was in the middle of year 12 when she had this accident. You see, she's still got stitches in her lip there. She had teeth smashed up, she'd lost teeth. And I said to her, look, you're in the middle of your year 12 studies. Do you think maybe we should wait till the end of the year and have your studies out of the way before we fix things? She said, look, you need to understand that my smile is so important to me. This is how, this is my whole personality and how I project myself to the world. And I can't go out at all. I can't face the world looking like this. So in her case, I said, okay, and she came from the country. She was from Port Pirie, and she said, I'm going to do whatever it takes because I need to get this sorted out. So she changed from this to this. And it changed things for her quite dramatically. And that's how she's ended up looking. And for her, it is such an emotional journey to think that she'd lost something that she considered to be the most important asset in her presentation to the world, that she's now got it back. So we have people that, I always look at the eyes to see what the results are like. Have we achieved a positive outcome for people? And this is what really makes a difference for us. We've got a passion to helping people transform their how they feel about themselves, how they present to the world, and I have to say, this is one of the things that really helps us attract a great team of people. Is that we finish treatments like this, and patients are overwhelmed, and at times they'll want to hug us and give us, I don't know, chocolates or flowers or something, but they're just overwhelmed with emotion when they have this sort of treatment done. And Nicole's been kind enough to allow us to use her image on, as you come in the surgery and on the outside of the building and so forth. So, I very much believe in using images of patients that we've actually treated in all our website and so forth. There's another lady. She came from Whyalla, and she was at the stage when she came in. If she laughed, she had her hand over her mouth. She felt very self-conscious. Her teeth are right on the edge. We weren't sure if we could save them or not. We assessed them, and she said she really wanted to try to save them. So we changed things from that to that, and that's her smile. And once again, you can see in the eyes the impact it's had on her. It's a very positive thing. So dental transformations really provide benefits for people beyond having a better smile, a better bite, more comfortable function. For many, it really is a life-changing event. It changes the way they feel about themselves. And many people say, look, it's given me more self-confidence, both at work and at home and out socially. So by transforming smiles, we're able to transform people's lives. And it really, it's what motivates us daily. We love what we do. Okay, let's go through the assessment process of what we do when people present to us. So this is a case where someone came to us with a single tooth that was unfortunately beyond hope, and that tooth needed to go. Now in this case, the patient decided to have a single tooth denture made up. That was their choice. And, you know, as people lose more teeth, they end up with a denture with more teeth added to it, and then eventually they end up with a full denture. And for some people, that's all they want. Yeah, they say, you know what, all my family members, my mum and my grandma and so forth, they've all had dentures, that's all I want. I'm happy with that. Now, let's talk about how they work. So full denture works a bit like a suction cup. It needs to have a seal around the edge, and it gets held into place like a suction cup in the mouth. And that works okay in the upper jaw, but in the lower jaw, there's something in the way. The tongue can, as soon as the tongue moves, it breaks the suction seal. So the suction cup can fall out, and I'm sure we've all seen people with dentures where the lower teeth tend to ride up over the lip and want to fall out. So not many people get on well with a lower denture. Some get on okay with an upper denture, but lower dentures are a struggle. So what happens if people come to us and they've already got all their teeth missing? What are their options? Well, traditionally, when people lost their teeth, and for people in Australia, a lot of people went through this years ago. They lost all their teeth and thought, you know what, this isn't so bad. And many of them coped pretty well initially. However, over the years, the shape of the mouth changes, so the suction cup effect doesn't work as well anymore. So we have progression. You know, we need to either make a new fitting surface or new dentures. However, eventually what happens is that the bone shrinks. Now, how does that happen? Well, having healthy teeth in the jawbone will help stimulate the jawbone to stay there. When teeth get taken out, many people don't realise that the jawbone starts to shrink away, and we end up with sharp bone at times under the jawbone. And this is a profile view of the upper jaw over time and the lower jaw over time, showing how bone can shrink. And as you can see in the upper jaw, we have quite a bit of bone to start with, and eventually it can end up like a thin razor blade. And that, under the gum line against a hard acrylic denture, can be sore. Same happens in the lower jaw, that we can end up with sharp bone under the jaw, under the denture rather. And the other thing to notice is with the lower jaw, you see the little black dot there on the lower jaw. Well, that's where the nerve runs through the jaw, and eventually the bone on top of it can shrink to such a degree the nerve's exposed on top of the ridge, and the denture sits there and it can pinch and hurt and give nerve pain through the jaw. In the upper jaw, we can actually end up, that bone shrinkage in the upper jaw can be so extreme that we can end up with virtually just an eggshell of bone separating the mouth from the air spaces above, from the nose, the floor of the nose, and from the sinuses. Now, if we're going to make dentures, well, you probably want as much bone as you can to try to grab onto the dentures so they don't move. So once we get to the end stage, the dentures are just sitting on flat bone and they can sort of skate around and flop around and tend to fall out. But here's the problem. If we wait too long before we put dental implants in, then imagine the last slide on the top with the eggshell of bone. Imagine trying to put a screw into an eggshell. It's just very hard to get good stability. So at that point, we've almost waited too long to have dental implants. So the point of this is that for each case, we need to assess very carefully if people have got enough jawbone, and we don't want to wait until there's so much jawbone missing that we're running out of options of what we can do. I mean, we do have options of how we can help people, but they can involve a bit more treatment. You know, there are other options that we can talk about. The other thing people don't consider at times is that that faces change shape. And people often think of, oh, if I have a tooth out back here or back here, who's going to notice? No one sees it. But all the teeth and the jawbone are there to hold the face in the right position. And in my lectures, I often give the analogy of the face and the teeth and jawbone being a little bit like the canvas of a tent with tent poles underneath. If you lose the tent poles, the canvas collapses. Well, the same happens with the face. That as the teeth and the jawbone go, the face collapses. And you can see this is the same patient, same person with teeth in and teeth out. And you can see what's happened here is that we've got beautiful lip support, nice profile, good full fleshy lips. And in the next view, we've ended up with concave facial profile, thinner lips, deeper creases, and nose and chin end up closer together. This particular lady said that she felt she'd aged 15, 20 years in no time at all. So the idea of the treatment is that we try to add back that lip support if we can. Now, some people are okay with dentures, and this guy reckons it's not a bad party trick to have his dentures. And people say that if they want to win funniest home videos, that a denture is not a bad prop to have. You know, you see these things fall out at times. But some people aren't. Now, why do people not like dentures? I mean, we get two categories of people, those that can cope and those that can't. Those that can't have various complaints about their dentures. So they say they have poor retention. These things can fall out at inopportune times. And this sort of thing's not a good look. And few people will accept that. I mean, there are all sorts of sticky things you can put under the dentures, but you know, most of our patients say they're probably better off with something like super glue to help hold their teeth in. It can be painful to eat for the reasons that we discussed before, the sharp bone or the exposed nerves, and so things like apples might be out. People end up eating softer food, and a recent study has shown that people with dentures end up with poorer health. They are more selective with their foods, their diet's not as nutritious, and eventually their blood test results suffer. So there's a deterioration of the entire body as a result of losing teeth. Speech can be affected. I mean, if the suction cup effect's not working really well in the mouth, then people can end up with using their lips and their tongue and their cheeks to sort of help hold the dentures in, and they can end up with a bit of a speech problem. So they can end up with a bit of a lisp. The other thing, socially, people find that having to take their teeth out after every meal and taking teeth out at night, leaving them next to the bed in the glass, doesn't suit everyone. We see people that say things like, oh, I've been married 30 years and my husband has never seen me without my teeth. Now, can you imagine how how your feet would look if you didn't take your shoes off in 30 years. Well, the mouth's the same. The people that wear their dentures constantly for 30 years end up with fungal infections, and these fungal infections can actually be a risk to their general health. If they end up compromised with their health, they can inhale this, end up with lung infections. So there can be serious consequences. The other thing is people are embarrassed. You know, some people feel, I just don't feel a whole person when I'm wearing dentures. Having to take these things out, I just feel embarrassed socially. So, what if people say, I don't want dentures, and they're simply unacceptable? Well, we have options. First option is just adapt. Try to cope better. I mean, 20 or 30 years ago in Australia, that was pretty well the only option. Toughen up. Now, these days, I'm not so sure people are willing to cope with things as much as they were maybe 20 or 30 years ago. They know they have choices. Back then, they didn't. The next option is to have better dentures made. And it is possible. There are specialists around, such as prosthodontists, that can help make better dentures. And that's what we have at this practice. So it is possible to do it. It takes more time, but not everybody's mouth is going to be suitable for dentures. Some people have no saliva. It's just not possible. They have no bone. It's not possible to make technically good dentures. Then the final option is the dental implant option. Now this is an option that's changed people's lives. It was an accidental discovery almost 50 years ago, and it's something that's now changing lives worldwide. It's a procedure that is reliable and gives great results. So what is it? Well, essentially it's a sophisticated tooth replacement. So where the original tooth comes out of the jawbone, a new replacement root goes in and the bone grabs onto it just like the original tooth. And this supports a restoration, which can either be a single tooth or can be a full set of teeth on top. We either call it a crown or a bridge or something like that. The nice thing about it is, remember we saw the bone shrinking away when we take teeth out? Well, if we put dental implants in, it actually stimulates the bone, helps maintain the bone long term. So what are the benefits of dental implants? Well, the key benefits are that we get better function, we can have a normal diet again, food tastes better. You remember with the denture, the palate was covered, and often people complain they can't taste their food well. They're more comfortable, speech improves, and it can give better appearance. It supports the face better. And self-esteem returns. I mean, we have people that say, oh, I felt like a pussycat, now I feel like a lion. So let's talk about dental implants. So there are two broad approaches with dental implants. There's a traditional slower approach, and then there's a quicker approach, which we call the all-on-4. So let's look at the slower approach to start with. This is what we call the delayed technique. So this is the technique that is done by, in most situations around Australia. And this is what we used to do for probably 20 years. This is the technique that we did a lot of for people. Initially, teeth are removed, and then we allow healing to occur. The jawbone heals. People may wear dentures during that time if they can put up with dentures. Not everyone could. And then the implants were placed. Then the implants are uncovered. Now these are already 3 stages of surgery. First one being removal of teeth, the next one being placing the implants, then uncovering the implants. And during this phase, people wear dentures if they can. Some people couldn't. We found there were those that just could not tolerate dentures. We then placed the restoration on top. We placed a teeth that we can bite with. The problem was, with traditional approach, often there wasn't enough bone. So people needed a 4th stage of surgery, which involved taking often bone from the hip, putting it into the jawbone. Now, not everyone wants that done. I mean, each time we have surgery, people need to, people go through a period of discomfort. They're going to have some time off from their normal duties at home or at work, and they need to recover. This doesn't suit everyone. So the delayed approach often had a difficult denture phase for maybe 6 to 12 months, could be longer, loss of normal function and loss of self-confidence. Typically, there were multiple surgical steps involved, and the principle back then was the more implants, the better. The more implants we could put in the jawbone, the better the result. Well, this is found not necessarily to be the case, and that often if we put more implants in, they were put into jawbone that was actually compromised or it needed to be grafted, which didn't necessarily give us better results. Often people needed bone grafting, and treatment was usually done in hospital. And for most people, going to hospital is not necessarily a place they want to be. They often want to avoid that. And costs became prohibitive for most people. The costs could be quite extensive, having all these different rounds of surgery. And the costs are not just the financial costs, but the time off work costs and the time off, being with family and friends and work and so forth. So this is a case that we did about 15 years ago now, and this is the traditional approach. Well, you see we did 8 implants in the upper jaw, and you see this shows where we had bone grafting in the sinuses at the back here, lots of implants. I think there are about 7 implants in the lower jaw. We've come to realise that this was a lot of treatment that was not maybe necessary to be so extensive. There must be another way. So we were challenged with this around the world. How could we simplify things? At the end of the day, dentures versus implants, people make a decision. Usually it's a quality of life decision. They make their minds up as to, well, how important is this for me? And I was at a recent conference where someone presented a paper where they did dental implants with someone who was aged 102. Now, why would someone aged 102 have dental implants done? Well, this particular lady said, you know what, I don't know how much longer I've got to go, but I know that I want good quality of life for my remaining years. And he showed another photo of her at the age of 104, and she'd had 2 great years of enjoying her smile and her teeth. So that was the traditional technique. So the other technique is the all-on-4 technique, and this is to be able to do things quicker. So there's some principles here. With the traditional approach, we need to consider where's the bone. So the bone, typically, we have anatomical limitations in the jaws. So in the upper jaw, we have air holes. We have the nose at the front for breathing through, and we have the sinuses. So typically, the best jawbone is at the front part of the jaw. With our traditional approach, we always thought that implants needed to be vertical, up and down, parallel. And if you want to place implants towards the back, because we want to support the last chewing teeth, we'd end up with implants in eggshell bone. And the only way around it was to graft the sinuses and put implants in. Well, maybe there was another option. So the concept was that maybe we could tilt the implants into this good jawbone at the back here and use that good jawbone. So now we're able to place just 4 implants, but really strategically in the good bone that's already existing without the need for grafting. And it's like 4 legs of a table. You only need 4 legs to support the table, but you need the legs in the right spot. And that's the critical thing about this technique. So that shows, that's a schematic diagram showing that the implants are in the jawbone of the original jaw, and then the new teeth go on top. They're little connectors going through the gum line. And the new teeth, you'll notice that there's white bits and there's pink replacement. Now, this is important to give people the most beautiful appearance. People often say, oh, I just want white. Well, the issue in a situation like this where the gums are flat once the teeth go, we're going to end up with square, long, white teeth. People don't find that necessarily very attractive, whereas a beautiful smile has nice white bits and pink bits. So the pink scallop around the teeth drapes the shape of the teeth, and it gives the full smile effect. So the pink appearance is just as important as the white appearance. So the aim was to eliminate the need for dentures, to do shorter treatment times. We can now provide teeth in 1 day, only 4 implants per jaw, no time without fixed teeth in place, and the entire procedure can be done at one location. If it's designed appropriately, we should be able to do it in 1 day. And it's performed under general anaesthetic with quicker recovery time. Now, why is recovery time quicker? Well, when people if people just have a denture, they'll have teeth out, they'll have exposed sockets, these holes in the jawbone, and the denture goes on top. Now, we've got exposed bone there. If blood clots fall out, it can be sore. There can be sharp bone. It's like a razor blade under the denture, so it can be very sore. Whereas with the all-on-4, we actually cover the surgical site. Stitches pull everything together, and the bridge goes on top to protect things. So people recover fairly quickly. So, are dental implants for me? Well, they're not for everyone, so let's have a look. What considerations do we have? Well, people need to have good bone and good gums. And everything needs to be pretty healthy. They need to have good healing capacity, so no health issues or medication issues that might affect their healing capacity. The keys to this are, that if people can't have other types of surgery, well, they're not going to be able to have dental implant surgery. So, also need to have the appropriate surgeon. So, the key to this is not about placing implants just where the jawbone is. The key is to place the implants in a position where they can be used for the final smile and the bite. And unfortunately, we've seen situations where implants have been placed and people have come to us and said, "Oh, here you guys can give me a nice smile." And we've looked at the implant and said, "Look, I'm really sorry, but we're not going to be able to use these implants for you." What do you mean? They're already in. Yes, but they're not in the right spot for what you're trying to achieve as far as the smile goes, unless you're willing to compromise. So at times, unfortunately, we've taken implants out and done them again. So they need to be placed in the right spot, and we need to have the appropriate facility and systems. So we assess people's current condition. Are the teeth healthy or not? Can we save them or not? And we look at their general health. It's very important to assess the general health. So it was very important for us to have an on-site specialist anaesthetist. Our resident anaesthetist, Dr. Jim Conadaris, provides our services for us. He's able to provide general anaesthetic services where people come in the morning, they have a sleep, they come in with perhaps very broken down teeth or problems, they have a sleep, go home with a brand new smile and a new bite. When he set things up, he said the primary concern was safety, that he wanted good systems, good equipment, and the right team with recovery area, recovery staff, and so forth. Assessment. So if people are thinking, yes, I do want to go the next step and assess things, the first stage is to get a conventional two-dimensional X-ray. This is what we call an OPG, which gives us a quick overview of the status of the teeth, where are they, what's missing, how's the bone, are things stable, unstable, and so forth. Then people meet me. We actually sit down. I want to hear each person's individual set of circumstances, concerns, issues, and so forth. No two people are the same. It's important we understand that so we're able to customise a treatment plan to suit individual people's needs. So the next step, if people are ready to start proceeding with the all-on-4 assessment, is to get a three-dimensional X-ray. We can do this on site, and assess the amount of bone available and see if we can place implants in virtual reality to decide whether there's enough bone there or whether we need to look at other options. What happens if people have waited too long or there's too much damage? Well, then we need to talk about, do we need grafting or do we need to consider other options, such as running out of bone here, we go to the cheekbones, next level up, what we call zygomatic implants. So this is a lady who was struggling to wear her upper denture and was looking to have dental implants done. And so the x-ray of the upper jawbone, the two-dimensional x-ray is not enough. We needed the three-dimensional x-ray to start, and you can see the three-dimensional x-ray here with the hole for the nose at the front there. But if we rotate things around, you can see the bone's actually kind of thin and razor blade-like. And if we look at that cross-section, that's the sharp bit of bone coming down. And if we place our dental implant in there, there's just not enough jawbone. So it's a bit like putting a screw into the jawbone like that. It's just not going to be stable. So she had two options. One was to consider bone grafting, to add to the replacement, to add back where the bone was missing, or to go to the next level, which is to go to the cheekbones, to have cheekbone implants. So these are always the considerations. Planning. So what other diagnostics do we need? Well, we take a series of photographs of people, we start planning what's their final tooth position going to be. If they've got an existing denture, then it may be acceptable, it may need to be remade. They may need to, if they've got existing teeth, we'll actually set up the new teeth in advance so that people can see what sort of characteristics are possible with their smile. And they can have input into, they can tell us, do they want natural or unnatural? Do they want unreal, fake or natural? That's their choice. So on the day of procedure, people come in, have their general anaesthetic. If they've still got teeth, the teeth are removed and implants are then placed. And we make up the new teeth while they're in the recovery area. So that all happens in our dental laboratory. And the teeth look a bit like this. So you can see the screw access holes, which are in positions where they're not seen, and we plug them up with little white fillings. And that's the sort of result we have. And you see, this is a set that's been made for a gentleman that is he's not 19. So there's a certain amount of character. You'll notice that the teeth are fairly strong-looking masculine teeth. The lower teeth are a little bit crooked. It's just, he didn't want them just dead straight. And that's where the screw access holes are. Interestingly, we do see people getting implants done at various places, and there are various standards with dental implant treatment. This is someone that had dental implants placed in the lower jaw, and she presented to us with severe problems. And you can see the lower implants have been placed straight through that red line, which is where the nerve runs through the lower lip. Now, with that, you can expect that the lower lip is going to be numb. That's one thing, so permanent numbness of the lower lip. In her case, she actually not only had numbness, but she had severe burning pain. And she was going to have that for the rest of her life. And unfortunately, she needed to have medication to help her cope for the rest of her life with that kind of pain. It was emotionally causing a lot of trauma. This is another case. This is a case where rather than the dental implants being placed into the jawbone, they've been put through the side of the jawbone into the tongue in this case. So you see the outline of the lip and the chin, and the implant has missed the bone completely. And there have been cases reported where people have had pretty serious consequences. The tongue has blown up to the point where it's blocked the airway. And if people get there in time, they can put a tube in to breathe, but at times people have died from this kind of treatment. This is an upper jaw. This is a case where a lady came to us and said, "Oh, I've got a bit of pain up here from implants that I had placed." And if we have a look, unfortunately the implants are not in the jawbone, they're sticking out the side into the cheek. So these needed to be removed. So I guess it's very important that surgery with dental implants needs to be done meticulously. It's important that things are placed exactly where we need them. It's a precise procedure. It needs to be done delicately and with skill. So what expectations are there? Well, people can, we recommend people take maybe a couple of weeks off work. Some people feel ready to go at 7 days and back to work, but for others it might take a little bit longer. So we ask them to take those 2 weeks off. They need someone that will actually drive them home on the day of the procedure and be with them overnight to just make sure they're okay. And then we have a series of reviews over the coming weeks. We take stitches out and we go through cleaning procedures. People often ask, how do you clean these things? Well, we'll come up with a technique for each individual to clean, but typically it might be a brush or some special floss or even a little water blaster that gets under the bridge. As with a new car, we need maintenance. If people drove out of the showroom and didn't go back to the dealer, imagine what the car would be like after 10 years. So the same with this. We want to see people every year for reviews, and as teeth, if they break or whatever, the nice thing is it's quite easy to unscrew this and lift it off and to do repairs. Typically we can do that, repairs in a day. If someone bites on maybe on an olive pip or something, by accident and breaks a tooth off, well, they're usually able to come in, we can unscrew the bridge, do a repair within an hour, typically. So let's have a look at a few cases. So this is Tammy, who was told that she wouldn't be able to have dental implants because she didn't have enough jawbone. She was told she'd need grafting done and there wasn't enough jaw there. She was aware she was going to lose the lower teeth and she really didn't want to go with dentures. We assessed things and were able to place 4 implants for her in each jaw and provided her with teeth on it in a day. So she went from that to that, and that's the change in her appearance. She always had longer, more prominent teeth when we looked at the old photos. This is Terry. He came to us having had treatment done overseas recently, and he was finding teeth were breaking off. Unfortunately, I had a bit of a look in his mouth and I said, "Terry, I think there might be other problems here. Let's have a closer look." So we took some x-rays and we could see infections in some areas. We could see that the fit of things weren't too good. There's a split here where there was an abscess, and the fit of these crowns was technically not good. And the bacteria were getting in underneath the crowns and the bridgework. He came back 3 months later and he'd lost virtually most of the treatment that he'd had done overseas. Very disappointing for him. So we had to look at the next step, which is to make implants to go on top. That's the all-on-4 technique. You end up with replacement teeth. And for that, it's changed his life. This is a patient that came to us concerned about a bit of disease in his mouth. He thought the veneers might be able to sort things out. But we had a closer look and he had fairly advanced gum disease, and that was the reason for the teeth starting to drift and move. And for him it was important. You can see the teeth are getting really long, the gums are shrinking away, there's really not much holding these teeth in place. So he ended up having these teeth out and dental implants in, and the change in the smile went from that to that, and for him that was a really positive change. He said it was important for him to connect with people socially, at work and so forth. It's a lady who knew that she had problems, was kind of embarrassed about laughing, didn't want to show her smile, and was worried about what the future might hold. So you can see she had disease. There was bacteria causing decay and gum disease. And so in her case, we removed the teeth, placed the 4 implants in each jaw, And that's the change. She went from that to that. She tells me it changed her life. This is a gentleman that, you know, he had a bit of a, he always liked to have a cheeky grin and a laugh, but he knew things were starting to go wrong in his mouth. And, you know, I mean, people have different reasons why things are going wrong. There might be disease or neglect or health issues and so forth. And in his case, you can see there's not much bone holding the rest of these teeth in. He's running out of bone. But in his case, we're able to remove the teeth, place the dental implants, and then place new teeth on top. And he went from that to that. This lady was struggling. Teeth are starting to drift around and gaps are opening up, and she really didn't like the way things were functioning and she felt self-conscious about the appearance. So implants were placed and her smile went from that to that. And for her, just gave her a better sense of well-being. This guy was struggling. He had advanced gum disease. The bone that was meant to be securely around the teeth had shrunk to the point where the teeth were starting to get loose. So they were starting to get mobile, and we ended up, the teeth were falling out one by one. So we placed dental implants, and the new teeth went on top, and his smile changed from that to that. And for him, it was, he said he just felt, you know, he was at a time of his life when he was trying to, he said, you know, he'd had a bit of a rough time in years gone by, and now was the time to start rebuilding everything. So it was to build his confidence up. He felt more presentable in public. This lady had quite worn teeth. She was at the point where she was too embarrassed to show her smile. And so we're able to lengthen the teeth for her with the technique. This is the last case I'll show you. This is someone who came to us with serious problems with the jaw. But I guess this is a slightly different case I want to show you, because it's not just about replacing the teeth in the existing position. I said to him, we can either conform to what you've got or transform things. It's really your choice which way you want to go. And he said, well, you know, I've always been unhappy with my facial profile. I feel I go from my nose straight back to my throat. There's nothing much in between. And I said, well, we can address that, but it's going to be important that I'll put together a team of 3 specialists to address this for you. And this is the change that we achieved for him. If you just look closely at the change in the lower facial profile, this is him before, and that's him after. And for him, you know, he works out in the country. He said it's just given him an increased level of confidence when he goes to work and socialises with his mates, that he just feels like a whole person again. So there've been numerous cases that we've shown you. We do have a website. People ask us to put together a website that's got information on it. We keep updating the website. There are numerous cases on there. There are videos and so forth. You know, if you'd like to go the next step, clearly we're here to help you. Come in. We can organise a consultation, some X-rays, and we can talk about your options. Okay. Each person is different. You'll be treated with respect, and you'll be amazed at what's possible. So I thank you for your time today. Thanks very much.